Good morning. Thanks for joining us today. Welcome everyone to the third session of our four-part York Circle at Home lecture series for this academic year. I'm Julie Lafford. I'm the Executive Director for Alumni Engagement at York University. I want to start today by acknowledging the land that we live and work on. As this event is virtual and we're not all gathered in the same space, I recognize the following land acknowledgement might not be for the territory that you're currently on. And if this is the case, please take the responsibility to acknowledge the traditional territory you're on and the current treaty holders. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of the university. York acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaronto has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. I am personally grateful for the opportunity to live and work on Treaty 13 land. I want to acknowledge those in the audience who registered for and attended 3 or more sessions. As a special thanks, you will receive a York U mug. And at each of these sessions, you'll have a chance to win one of $25 gift cards, courtesy of our affinity partner, MBNA. We'll draw the names of the gift card winners at the end of today's session. Today, Dr. Pillay Riddell, Associate Vice President, Research and Academic Chair of York Circle, will host presentations from 5 York University experts, followed by a panel discussion and a Q&A where the speakers will answer questions from the audience. If you'd like to submit a question, please use the Q&A button at the bottom of your screen. Dr. Pillay Riddell will pose as many of your questions to the panelists as time permits. As always, the presentation will be recorded and uploaded to our YouTube page for you to share with family and friends. Today's lecture, titled Racism in a Pandemic, More Than a Health Crisis, is deeply relevant today. Before we begin, I'd like to take a quick poll, and here's my question. How would you rate your knowledge of the topic of today's presentation? So that poll should pop up on your screen now. Please take a moment to respond. So thanks everybody for your responses. It's always helpful for our speakers to know who is in the audience. And I see from the poll results, 65% of you feel somewhat informed, 11% very high, and 24% minimal. Thank you for your responses. It is very helpful, and it's wonderful to have so many attendees today who are engaged with this topic and eager to learn more. So without further ado, I'm delighted to introduce our host for this series and today's presentation, Dr. Rebecca Pillay Riddell. Dr. Pillay Riddell is a professor in the Faculty of Health. In 2018, York's Faculty of Graduate Studies honored her with the faculty's Teaching Award for her achievements in graduate teaching and supervisory excellence. Additionally, Dr. Pillay Riddell is a pediatric pain researcher and clinical psychologist at the Hospital for Sick Children in Toronto. As an acclaimed researcher, she leads the OUCH Lab, which stands for Opportunities to Understand Childhood Hurt, and where she seeks to reduce pain in child health. You may have also seen Dr. Pillay Riddell's work in the news last fall. She published a paper finding that skin contact with a parent may reduce baby's brain response to pain. So welcome, Dr. Pillay Riddell. It's always a pleasure to have you join us. Thank you, and I'll turn things over to you now to introduce today's panelists.
Thank you so much, Julie. Good morning and welcome, everybody. I hope everybody is staying safe and well during this time, fighting the pandemic fatigue I think that we're all feeling. We're on the verge of a year when we've lived in this new normal, and this new reality. I think I've always enjoyed my role. It's one of my favorite things I do at York University as academic chair of the York Circle series. But I think in the pandemic, having this opportunity to come together as a larger community with some of the amazing experts that we have at York to help us guide us through the information and misinformation of York, this is a particularly favorite year for me. The pandemic has presented everyone with unprecedented challenges for our generation. York Circle has decided to highlight the diverse strengths of York researchers, from molecular scientists to policymakers, to engage audiences in a lively intersection of ideas related to the pandemic. For the first time, York Circle has brought together multidisciplinary panelists to dissect and discuss 4 themes over the 4 sessions throughout the 2020-2021 academic year, all of which within the context of COVID-19. Today is the 3rd topic of the series, entitled Racism in a Pandemic, More Than a Health Crisis. We hope you will join us for our next session, just thinking a little ahead, the impact of the pandemic on the environment, on Saturday, April 17th, which will conclude our series for this year. As Julie said, while we cannot meet in person due to the pandemic, we're honored to provide a virtual opportunity for us to learn from these highly recognized and respected professors and scholars at York to share their research with all of you in a few moments. 1 year into the COVID-19 pandemic, the impact of racism on many communities has been compounded. In today's session, York experts will discuss the effects and implications of the pandemic on Canada's marginalized communities. Our first speaker, Jack Rozdilsky, will discuss the concept of social vulnerability and define the pandemic akin to a disaster management paradigm. Dr. Sheila Cote-Meek, our esteemed Vice President, Equity, Peoples and Culture, will discuss the impact on multi-generational families in the Indigenous community. Dr. Jude Kong of the Canadian Centre for Disease Modelling will address policymakers' neglect of the Black community and the lack of data that contributes to it. Dr. Robert Kenedy, whose work examines co-curricular and curricular peer education, mentorship, and leadership, will discuss scapegoating in the Jewish community. Our final presentation will be with Dr. Cary Wu, whose research focuses on political culture, immigration, and inequality. He will bridge the challenges across these marginalized groups and what pandemic recovery could look like. I'm so pleased that Jack, Sheila, Jude, Robert, and Cary could join us today. I know you will learn so much from their presentations. I will now introduce our first speaker, Dr. Jack Rozdilsky. Dr. Jack Rozdilsky is an associate professor and the graduate program director of the Disaster and Emergency Management Program at York University. In February 2020, he received funding from the Canadian Institutes of Health Research to explore the experiences of Chinese diaspora communities, communities in Toronto and Nairobi, with the goal of developing destigmatization campaigns to prevent the unfair targeting of ethnic groups during infectious disease outbreaks. Welcome, Jack. Thank you for joining us today.
Thank you, Rebecca. And I'd also like to thank the audience for joining us this Sunday morning on this important topic. Rebecca, if I may, I'd like to share a few slides to accompany my presentation. I'm going to be speaking this morning about social vulnerability and pandemic racism. As said in the introduction, I'm a professor of disaster and emergency management at York University. And one of the disasters that I have been looking at in recent times has been COVID-19. Before I go any further into my presentation, I'd like to pause for a moment and acknowledge this morning that over the first year of the pandemic, we have lost 21,960 Canadians. And I think it's always important when we speak about these topics that we acknowledge the losses and suffering due to the pandemic that are taking place around us very close to home. From a disaster and emergency management perspective, when we look at these types of crises, there is a factor at play which we call social vulnerability. That means some groups in society are more prone to damage, loss, and suffering in the context of hazards and disasters than others. Factors that contribute to social vulnerability include race and ethnicity, socioeconomic status, gender and gender identity, and age. Over the years, I have looked at many disasters and crises. About 16 years ago, I was one of the persons with boots on the ground during Hurricane Katrina on the southeastern, on the Gulf Coast of the United States. And one of the things, when we were on the ground during Katrina, there were many immediate response and recovery activities which needed to take place. But once we had time to reflect on that hurricane catastrophe back in 2005, one of the things that was becoming very obvious to us and many others is that there were other factors at play that contributed to the severity of the disaster, including disproportionate impacts of the disaster as faced by racialized minorities. During Hurricane Katrina, due to issues of income disparity and systematic racism, residents of New Orleans faced many barriers preventing their evacuation prior to the hurricane, where it was observed and documented in many ways how African American residents of the city faced disproportionate impacts of that natural disaster. Pandemics are another type of disaster that we look at and consider in the field of disaster and emergency management, and one which is taking a lot of our attention right now. If we look at pandemics of the past, specifically, we can look at what happened in the 1918 pandemic about 100 years ago. There's been a tendency to shift the blame to others during these types of crises in the community. Where with the 1918 pandemic, the Spanish flu name reinforced a conflation between immigrants and disease. And going as far back as 100 years ago in that pandemic episode, there were instances of pandemic related racism. Moving to the present time, as many of us are aware, um, amongst the many poor behaviors of the past president of the United States, the prevalent use of the problematic phrase China virus and the entire rhetoric around the China virus. We know going back about a year ago that the point of origin of the COVID 19 virus was in China, but using language such as China virus, using that type of rhetoric, as we have seen over the past year, that rhetoric sets the stage to reinforce negative racial stereotypes that have existed prior to the pandemic episode, but are being enhanced during the pandemic episode. And as mentioned in the introduction, one of the research projects I'm working on is looking at some of these impacts. I'm working with a team to explore how the Chinese Canadian community has been negatively impacted by such negative racial stereotypes due to the pandemic, and also how the Chinese Canadian community can respond to and overcome these negative stereotypes by using their own developed capacities, which I think we can all learn from and moving forward with COVID-19 as we go into the second year of dealing with the crisis. So in conclusion, why do we care about these topics in relationship to COVID-19? Why do we care about social vulnerability? The problem of pandemic racism contradicts the values of promoting health and safety of all with the goal of saving lives during COVID-19. For example, discrimination results in infected persons not being properly, as persons who are feeling direct and indirect discrimination may have fears leading to them taking action to avoid seeking medical treatment in a timely manner. We are also observing dangerous trends in society in Canada where racist rhetoric surrounding the pandemic creates a permissive environment for racist actions to take place, which can lead to hate crimes. And over the last year, during the pandemic outbreak, there has been a marked increase in both microaggressions and outright actions, more and outright direct actions that are hate crimes faced by the Chinese Canadian community, with persons falsely conflating the COVID 19 pandemic with Chinese Canadians. So, again, to conclude my presentation, when we look at any type of disaster that we may be facing, disasters from a natural, technological, or social origin, including disasters of pandemics, social vulnerability is a factor that can be in play. And specifically, as related to the disaster we are currently all living in, racism related to the pandemic is harmful as it contradicts the main values of promoting health and safety with the goal of saving lives and getting us past this pandemic so we could potentially move to a situation of recovery in 2021 and 2022. That is the conclusion of my comments. Thank you for your attention.
Thank you so much. I think it's such a wonderful framework to now begin our conversation about pandemic racism and social vulnerability in this context of the rest of our talks. Thank you so much.
Thank you.
I will now be introducing our next speaker, Dr. Sheila Cote-Meek. Dr. Cote-Meek is Anishinaabe from the Tem-Ogama Anishinaabe. She is the inaugural Vice President, Equity, People, and Culture at York, where she leads a team that includes the Center for Human Rights, Equity Inclusion, Labor Relations, and Human Resources. Dr. Cote-Meek is a well-known provincially and national and internationally recognized leader for her work promoting equity and inclusion in higher education. Welcome, Dr. Cote-Meek. I'll turn the floor over to you.
Thank you, Rebecca. So good morning, bonjour. Thank you for the invitation to join this panel. And I'm really looking forward to hearing from the other speakers as well. I still have lots to learn about the impact of the pandemic on various groups of people. Today, I'm coming to you from the traditional territory of the Atikmashing Anishinaabe in Nisswakmak, otherwise known as Sudbury, Ontario. This morning, I'm going to focus my comments specifically on Indigenous peoples and my own thoughts about how racism and how the pandemic has exacerbated the current conditions for Indigenous peoples here in Canada. So first, who are Indigenous peoples in Canada and who am I referring to? I am referring to First Nations, Métis, and Inuit people here in Canada. And according to Statistics Canada, there are approximately 1.6 to 1.7 million Indigenous peoples living in Canada. Approximately half live on quote unquote reserve or in a First Nations community. And approximately 60% live in rural and remote areas. So that's just a little bit of context about who I'm speaking about, but I'm going to focus my comments in terms of the pandemic on three specific areas: health and living conditions, and poverty. Just generally around health, we know that Indigenous peoples have poor health outcomes, higher rates of chronic conditions such as diabetes, cancer, etc. We also face higher mortality rates. Our life expectancy remains much lower and as much as 15 years in comparison to the general Canadian population. So for example, Inuit life expectancy for males is 64. In the general Canadian population, that same group life expectancy is 79. For women, First Nations is 73 and 78 for women, sorry. So we know that there are higher mortality rates already that exist in our communities. In terms of living conditions, I'm sure that many of you have heard about the living conditions, especially in the far north. We have housing shortages that exist in communities, which has led to a lot of overcrowding. Many houses have no electricity or no running water. There have been reports of ongoing issues related to mold in homes, all of which affect the health and well-being of people. Access to clean water, it's unreal in this day and age that boiled water advisories continue to exist. And while there has been some work done and some progress on this, there are still 57 long-term drinking water advisories in 39 First Nations communities as of January 2021. Accessibility to services for many First Nations, Métis and Inuit people remains limited, especially when they're living in rural and remote areas. The sheer cost of transportation in the far north is exorbitant. There are issues with food security, and this has been exacerbated by the increased cost of foods and products. There are high rates of poverty as a direct result of lower access to employment opportunities, as well as lower access and levels of education in our communities. So what has been the impact of this? So in terms of health conditions, living conditions, and poverty, there is an increased vulnerability and risk of developing COVID. Increased stresses when business and schools close, add increased stress in terms of income, the availability to access work to support one's home and household, access to proper nutrition gets compromised further. In many communities, it's difficult to access internet, which exacerbates the issues further. As jobs and employment close down, available work and access to work becomes increasingly challenging and difficult. And these disparities in health are exacerbated by high rates, as noted by the first speaker. We have seen also a rise in anti-Indigenous racism in general Canadian society. So let's talk for a minute about racism. There's no doubt that racism exists in society and that it is systemic, meaning that it's embedded in the systems that perpetuate ongoing racism. For Indigenous peoples in this country, racism is rooted in long-standing and historical colonial practices and policies that remain in place. They come out in different ways, but there are pre-existing stereotypes that exist for Indigenous people. We know that access to quality healthcare is implicated as a direct result of pre-existing stereotypes. Indigenous peoples often feel that to access healthcare means that they have to subject themselves to ongoing forms of racism, where their issues around health are often dismissed and or minimized. There still remains inequities in housing and living conditions as a direct result of the displacements from land and traditional practices. And these historical and ongoing practices have contributed to the current place that Indigenous peoples find themselves within this pandemic. The pandemic has has magnified these racial inequities. And it's been said by a number of people that for many people that have already been living in kind of a very oppressive conditions, Indigenous peoples, Black peoples, for example, that they are living in a pandemic on top of a pandemic, meaning that the rise of anti-Black and anti-Indigenous racism is a pandemic in and of itself, and other forms of racism have increased during this pandemic. I look forward to the comments from the other speaker, as well as engaging with the questions from the audience. Miigwech, merci, and thank you.
Thank you so much, Sheila. That was a forceful reminder of the inequities, the vast inequities that Indigenous peoples face in Canada, and how the pandemic is compounding and exponentially exacerbating that. Now I'd like to introduce our next speaker, Dr. Jude Kong. Dr. Kong is an assistant professor in the Department of Mathematics and Statistics at York University. He is a member of the Canadian Black Scientist Network and the Canadian Centre for Disease Modelling. Additionally, Dr. Kong leads the Africa-Canada Artificial Intelligence and Data Innovation Consortium. Dr. Kong is an expert in data science, machine learning, infectious disease modeling, and population dynamics. His principal research objective is to use mathematical, statistical, and computational modeling to study the impact of environmental stressors on species distribution and the dynamics of infectious diseases. Thank you for joining us, Dr. Kong. I'll turn the floor over to you.
Thank you for the great introduction, Rebecca. And Sheila, thank you so much for outlining what the Indigenous people and the Black people face in, not just in Canada, but around the world. Rebecca, if you could permit me to share my screen, I'll be very grateful. Oops, let me see. Yeah, okay. I will be talking today about the intersection of the pandemic and anti-Black racism, which is something that Sheila already spent time to talk about, because Black people, just like our Indigenous people here, face almost the same racism when it comes to things like this. So my hope at this point, at the end of this presentation, is to drive a conversation where we look at saying that the pandemic are not racist. Pandemic do not come to affect a particular group of people, and not just about the pandemic a lot, but our policies, the policies that we have put in place, our institution is racist, and that have led these communities to a situation where they end up being very susceptible to the pandemic, or not just pandemic alone, but disasters that we've been having in the country. I remember Jack talking about this. So I want to take us all back to what happened immediately after slavery was abolished. When slavery was abolished, Black people were told, during slavery, Black people were only allowed to entertain their slave masters, either by playing football, fighting to entertain them, dancing to entertain them, at the pleasure of their masters. But when slavery was abolished, these people were told, we don't need you, and they were sent to particular communities, the so-called inner cities or hood or whatever people use. I don't use those terms, but whatever people use in their communities to call my people, or the communities where my people live. And what happened when they were pushed out of these communities is that when they got into these new communities, they had to live close to each other. And I'm talking about the houses that they live in. And before the Housing Act of 1938, if I could remember, in North America, these people were not even allowed to buy houses in any other community. This is where you have to live, and you can't buy a house in my neighborhood. They stayed very close to each other. You may look at this to be like, okay, yeah, we choose to segregate. Why? And then what? But the point is, when a pandemic like COVID visit our country or our neighborhoods, these people that live very close to each other in these communities end up being very susceptible, and it spread within the community. Now, why these people were in these communities, living in these houses that are very low income community houses because they were pushed there by the pandemic. I don't want to talk about the educational system that they had received based on that, because while they were slaves, they were only meant if you were seen reading, you would be killed. They only had to dance, play football, and be a slave master. So they end up in this community. The educational system now, we did our educational system to based on your zip code. I don't want to get to that neighborhood. I want to talk about the type of jobs now that they get because of the neighborhood where they live. Once they found themselves in this neighborhood, because of the same anti-Black racism, which best, if you listen to what Sheila already said, it transcends to Indigenous people. It leads to a point where a lot of people will not accept them in certain positions. And there are a lot of factors relating to that, based on what other people say around, or the people sitting on the table to make decisions as to who should hold certain type of jobs. Black people now that live in these communities that were bound to be there and were not allowed till the Housing Act of 1938. And even after the Housing Act, there is still this inbuilt nature where if you go to buy a house in the community, people say, we all have heard this. I don't want you to turn my community to a hood. And they're referring to Black people because they're responsible, according to them, they're responsible for everything negative in our world. So because of all those things, Black people end up in jobs where if you have a Black person apply for a position with a very good CV, very qualifying, and you have another person who just apply for the same position, if you don't blindfold the name and they indicate their race and everything is okay, they will not pick that Black person, they will pick the other person. Even though the other person is not qualified, they will say, there are allegations around, which I'll get to that. Black people are not smart, they will not do this. They don't look at Black people to be qualified to do certain jobs. And what happened is, if you were to blindfold it and you give it to somebody, that Black candidate will qualify. But the moment they see the name, Google it or whatever they do to check, no matter what, if the other person is not qualified because it's not Black, this is the negative race, he gets the position, he gets everything. Now, then what happens? Black people stay in those frontline jobs where other people are shining, where the Black, my community love it. We're not saying those are bad jobs, but we're saying that we end up having just one choice to go to particular types of jobs, because even if we are qualified and apply to other jobs, we will not get them. This is not made for people like you. That's what we'll be told. So they end up in those frontline jobs. And when a pandemic like this visits our country, it's a monster. It affects my people indiscriminately. Because of that, these inherent issues where they find themselves in the communities, and they had to take a lot of time in order to ensure that they are doing many jobs and raise their kids. It leads to a point where you have a mom or a dad, or two dads at home, or two moms at home, working overtime, working a lot. They don't have enough time. They have to buy food. And it leads to health issues as to what their kids eat, food insecurity, what they eat. It affects their health. It leads to underlying issues. And when a pandemic like this comes, it affects them. But the point is not that is the particular race that makes them more susceptible to that pandemic, like a monster like COVID. But it is that our policies put in place push these people to a student community, and based on policies, which I'm going to get into it, led them to a point where they cannot get certain jobs and they cannot change their family tree. They're bound to remain there. You are the worst. You're bound to remain where you are. This race is supposed to be there and be like that. You're bound never to change. That happens over and over. So they have health issues. Some of them, if you look again, after the Housing Act in North America in certain cities in the world in 1938 did not change anything a lot. I've heard a lot of people say when they're buying houses in Black neighborhood, a lot of mixed race families say, maybe since you're Black, you stay away so that I go, because if I go, because I'm white, I'll be allowed the house. But if you go, people will say, we don't want to change our neighborhood to a hood. I don't know what a hood is. I want to put this in quote. I don't want to use those type of words, because even if you struggle and you want to buy a house in those communities, you're not welcome. You belong to a particular neighborhood. You don't belong among us. If you happen to buy a house among us, then we are turning that community to a hood, or whatever people use. I don't want to use those terms. And it leads to a lot of my people being homeless. There are many reasons we could get a conversation. It leads to them being homeless, some of these policies. Then what happened is when a pandemic visits, because these people are homeless, they have no choice. You can decide. I have been staying in my house alone since March, not seeing people. But these people who are homeless cannot. They don't have that choice that I have, that a lot of people have. And they didn't choose to be homeless. Policies let them there. Believe me or not, if I get to buy a house right now, I can't have the same house in some neighborhoods that some other people will have, because neighbors will tell them, you cannot sell a house to this guy because you want to turn our neighborhood to a hood, whatever they use. I want to use this in court. When the pandemic comes, these people are very susceptible, but they didn't choose to. The policies which were anti-Black led them there. But the number of cases, why they are together, because they have no choice, leads to more cases in our community. And when more case counts come in the community, they increase the number of the SARS-CoV-2 circulating within our community. And what happened? Because they circulate there, and because of their living condition, their health situation, the type of job they do, the homelessness situation, increase more case counts in their communities. But you know what those policies make, and people say within their house in hiding? Because we have, after slavery was abolished, we moved to this subtle way where it's common to say within the house, please don't say it outside there. You can say it here, but never voice it out there. Black people say things about Black people as they don't respect rules. That's why they have a lot of comments spreading within their community. And you don't blame, at some point you don't blame, yes, I would not tolerate such a friend. If my friend says this, I will point you there and say it. I was in a talk sometime within this week, where in a public health talk, where somebody said that, you know what, the number of B117 cases in London are increasing because of Black people, the Black immigrants that are based in London. And I had to stop the talk and I said, please, can you substantiate that? But not on all the cases you have people substantiate this. These allegations continue, where you find that people in their homes, because you are supposed to say this in your home, and parents will say, don't say it outside the door, you can say here. They will say, Black people are responsible for this high spread. They don't respect rules. A lot of people say this, Black people do not respect rules. Again, I assume their naivety. Not everyone is educated enough or to do the research like myself and you to go back and do this finding to see why that leads to that. But they say that. And when they say that, they're saying in front of their kids. And those are the kids that will grow to the position, because the system is such that if you're a particular kid, they grew to a position of making decisions for our country, and they stand there. And so they will get to a point where they said, this is not for people like you that look like you. You belong to this particular neighborhood. And if you are in this neighborhood, you cannot buy a house in our neighborhood. So this continues within the system over and over and over. And if you look at this, I make this look at an infinity symbol. Why an infinity symbol? This is kind of an infinity, if you know what an infinity symbol looks like. This is an infinity symbol. Why an infinity symbol? Because the more we discuss this in front of our kids, they have within their mind that anything wrong is attributed to Black people. If you have a disease spreading, Black people are responsible. Anything negative, Black people are responsible. Without knowing that there are policies in place, starting from when slavery was abolished, and you have this silent slavery where Black people were pushed to a point where they have to be in prison. And in some communities in North America, they are paid 45 cents, which is more of slavery, to work an hour in the prison cell and other things. And with a pandemic or a disaster, I remember Jack presenting how the pandemic affected Black communities earlier on. It affects more of the Black people. So we discussed this, and our kids who grew up to take those positions, they don't do it out of ignorance. They believe, because they heard it from their parents. They heard it at home, that Black people are responsible for what is happening in our community. And so even if a Black person applies for a job, no, a Black person is not smart enough to get that job, or he will do this. This is discussed at the level of the home, and that leads to more anti-Black racism. And that circulates to lead Black people to confine Black people to a particular neighborhood. And that continues within our system. And then you have these two cycles, having this disasters prevalence among Black people and having these rumors spreading around here that are made in green here and red, the pandemic. And in order to break this infinity symbol, what we are suggesting is that we move to a point where if we were to, in case of having just particular group of people, particular color, we engage community leaders. We ensure that when decisions are taken regarding community, there's a voice from those communities that is able to present their own case and make a lot of people that may be naive to certain circumstances as to why things are happening in those communities, because our history do not teach them. They don't tell them that when slavery was abolished, Black people were bound to be in poor neighborhoods. Our history don't. I'm not a history teacher, I'm a mathematics professor, but I don't think our history does. I will allow it to history professors to correct me. But if we now move to a point where in our community we push our politicians, because politicians will react if you tell them they care about their votes. So long as you don't care about this group of people, so long as you follow them to assume that anything Black is negative, okay, yeah, they're happy with it and they continue with that. But if we were to move to a point where we bring Black voices, community leaders into the discussion about what happened among our communities, and leads to a point where when something comes like a pandemic, a disaster, we collect data. I have been part of the modeling force that's informing policies as to lockdown policies, part of the task force at the Field Institute here in Toronto, informing policies as to lockdown policies. How long should the lockdown policies be? I do modeling with respect to that, and I advise the Public Health Agency of Canada. But I don't get things about this racial transmission, racial data. But if we bring community leaders into the table, they will push for that. Yes, if their voices are not heard, they will try their best. I trust my people. They will always try their best to defend the interests of our people. But the point is, if we are able to move from a community where we have people that have been making decisions that are disaster to our communities, to a point where we include everybody to have a say. Again, I put my Black female sister here just to point that out, but there could be other faces that will be included in the conversation. Then we lead to a point where we realize that, yes, we, in the hospital now, not only 3 provinces in Canada will be collecting race data, and I'm shocked to say that Ontario only started on the 26th of May to be collecting race data. And how do you, looking at data be a pattern something? How do you claim to solve a problem if you do not take data to look at what is happening to these communities, pandemic or disaster, open disaster? If we move to a point where we have these people, they will have their voice within that, and they will voice that. Engage the communities, ensure that if they collect information, they don't misuse it. There's a lot of history of misuse of data, but you need community leaders to be present. And then we get to a point where we collect those data. And what happens then after? These type of allegations, a lot of people will be informed. A lot of our young ones will be informed, and they will not make allegations against these communities. You don't blame some of the young ones for making allegations, you blame the parents or the history for making that possible, that those allegations should be made about these particular race. So if we are able to have community leaders, embark them in our discussion earlier on, or have Black people allowed to apply for jobs or get jobs that they are qualified to do, they will be able to inform the policies. But our policymakers are very smart. They don't want them. They don't want those voices. They want things to remain the way it is. So I hope today we can move to a point where we canceled this intersection between this anti-Black racism and pandemic spreading to a point where we give a forum, we have Black community leaders, engage the communities to be Black communities, to be able to have a say, collect data about what is happening within the community, and use that data. I've been part of the modeling force in February, early last year. We met at the Field Institute where we used, it was early February when Canada had this, we decided to, the Public Health Agency asked us, gave us money to make at the Field Institute and see how we can use previous experience to inform future. But you know what was lacking in what they said? There was nothing about race, even though Black people and other racial groups have been affected in previous pandemic about future disease. Nobody cares. You know why they don't care? Because you and I don't talk about this. Yes, we can talk about it in my community. They don't care. Black people always complain. That's what these allegations will say. Black people are always like that. But because they don't pay attention, and you don't blame the kids from growing up with that, you blame the system, our institution. So I hope we'll get to a point where we're able to erase this intersection. And then you end up with a circle here that has nothing to go to. This allegation will end up dying. You end up with a pandemic that will end up dying. We cannot fight the pandemic if we don't address anti-Black racism or anti-minority racism. Thank you so much.
Thank you so much, Dr. Kong, for passionately discussing the historical context of anti-Black policies and how it's been intersecting with the science of COVID-19 transmission to perpetuate anti-Black pandemic racism today. Appreciate your time. Now I'd like to welcome our next speaker, Dr. Robert Kenedy. Dr. Kenedy is an associate professor in the Department of Sociology at York. He has been studying ethnic identity since 1989, with much of his research focusing on collective identity, ethnic communities, diasporas, anti-Semitism, multiculturalism, civic participation, immigration, and resettlement. Most recently, he has been researching Lusophone resettlement and education, the French Jewish diaspora, campus boycott, divestment, and sanctions, anti-Semitism, and the new anti-Semitism in Canada. Welcome, Dr. Kenedy, please. And I'll just ask Dr. Kong to stop sharing his video.
I did. Sorry.
No problem. Thank you, Dr. Kenedy.
Thank you very much, and welcome to everybody. Good morning, and thank you, Dr. Kong. I appreciate the very detailed presentation, and to my colleagues. Today, I'm going to be talking about. Hold on, I'm just going to share. And sorry. There we go. Sorry for that delay. Not only racism, but anti-Semitism and how it has affected the Jewish community, especially in Canada, but globally. And what I'm going to focus on is arguing that while anti-Semitism may be argued to be the longest hatred, the Jewish community is a resilient one. It's one that has constantly dealt with anti-Semitism that dates back to the Middle Ages and before in terms of plagues and of course, pandemics. Now, while COVID is unexpected, I would argue scapegoating and blaming the collective is unfortunately quite familiar. What I'm using, of course, is the IHRA working definition, which is a very long definition, but gives you an idea just to say, this is how I define anti-Semitism academically, educationally, and what I use in survey research. I find it very useful. It's something that the Honorable Thomas Cromwell talked about in his report, and of course, part of our university academic plan. Now, blaming and scapegoating the Orthodox and ultra-Orthodox as a visible community has been going on for thousands of years, but specifically during the Middle Ages, of course, the Jewish community was blamed for the bubonic plague between 1346 and 1353. So accusing Jews, visible ones especially, like the Tosh community outside of Montreal, of spreading the pandemic and not following rules is one of these tropes that has been brought on constantly and is one of our historical and sociological legacies. As you can see in this racist cartoon from the Jerusalem Post, the Jewish community is often blamed for creating, profiting, and a myriad of global conspiracies based on religious, political and pseudoscientific racism. This is something that is happening everywhere. And again, various Jewish communities are being targeted, especially visible ones, like the Orthodox communities in various countries. But again, I would argue that the Jewish community is a resilient one. I was at a virtual bar mitzvah yesterday, and we carry on and we move forward. And the Jewish community has that kind of strength in terms of a collective conscience and a resilience to make sure it thrives and carries on its traditions. So while I think the Jewish community has suffered a great deal during these difficult times, we all have suffered. Racism, unfortunately, seems to be thriving, and scapegoating seems to continue. But I think the idea is coming together and working together, things can shift and things can change. Thank you. I look forward to answering questions.
Thank you, Dr. Kenedy, for talking about and broadening our understanding of the Jewish community and how it intersects with the pandemic. A reminder before our next speaker, after the final presentation, we'll be hosting a panel discussion and taking questions from you in the audience. If you'd like to submit a question, please use the question and answer button at the bottom of the screen, and I will pose as many of your questions to the panelists as time permits. We never have enough time to get through all of the questions, but I will do my best. So for our final speaker, I'd like to introduce Dr. Cary Wu. Dr. Wu is an assistant professor of sociology at York University. His research focuses on political culture, immigration, and inequality. He often shares his research with the public via national and international TV, radio, and newspaper forums, including NPR, CBC, Toronto Star, Maclean's, and the Financial Times. He recently received funding from the Canadian Institutes of Health Research to study the social impacts of the COVID-19 pandemic. Welcome, Dr. Wu. We're pleased to have you here with us today.
Thank you, Rebecca, and thank you everyone for joining us today. Let me start with some stories. Joey Wong, a Chinese-American comedian, once he shared a story about how there was a bumper sticker that was pasted on his car, and it read, "If you don't speak English, go home." And he said he didn't notice until 2 years later, right? So I also often think about my personal experience when I was a student in the United States about 10 years ago. Sometimes I heard people shouted at me, "China man, go home, go back to your country." Right? I was thinking a little bit about like those kind of experience that I was just laughing about it like 10 years ago, right? Now I've been living here in North America for so long. If I heard some people shouted at me, I probably would do something, and also this kind of experience will have a bigger impact on me, right? So this this kind of stories and experience make me think about like how people experience racism, right? All the great panelists before me shared this story about how kind of ethnic racial groups could experience racism in very different way, of course, in very similar ways, but also in very, very different ways, right? So thank you for that. And my recent research, I asked this question: how do we experience racism? And in particular, during the pandemic, was the rising anti-Asian racism. So I look at how Asian Canadians in Canada, Asians in Canada experience this anti-Asian racism, right? So one finding from the data is that Asian Canadians that native born here, locally born Asians, perceive much more discrimination than the foreigner-born Asians, like Asian immigrants were born outside Canada, right? So this is the data, the fresh data from Canada we collected last December. So you can see Asian native-borns perceive much higher discrimination during the COVID pandemic than foreigner-born Asians, right? So we would expect that according to kind of like a assimilation, straight line assimilation theory, that we would expect, like, as people spend more time here longer, for immigrants, they would more integrate into the society. They will have more friends, and then they more support locally. They would perceive lower discrimination or racism. But the data shows the opposite pattern, right? So why? So why do locally born, native-born Asians, Asian Canadians perceive more kind of like racism or discrimination during the pandemic or in general? If you look at the other data, they also show similar patterns. So several factors. One is about higher expectation for membership, right? So for example, for Asians or minority groups in general were locally born, this is their country. Canada is their country, and probably is only the country they're holding passport, right? Citizenship. So if those locally born minorities were discriminated against, go back to your country, they would think, where's my country? This is home, right? So that could, higher expectation could have stronger impact on their experience. The other thing is about knowledge about discrimination. For example, 10 years ago, like, people shouted at me, called me China man, because my understanding, because before coming to North America, I probably have kind of, I have very little knowledge about this history about China man and all that. So I do not understand those kind of like racial slurs or like discrimination language, right? So it probably have less impact on me because of this kind of knowledge. The other factor could be the stronger sense among native-born communities, right? So for example, for people coming from Japan or Korea, they do not, in their own country, they don't often think about those being ethnic, right? Because that country, immigrants. But when they came to US or came to Canada, they would think more about being Japanese or being Japanese immigrants, or being Korean immigrant, being Chinese immigrants in this country, hosting country, right? But so for native born, they often think in school during socialization period of time, they often think about those identity, and those identity could kind of like moderate how that's kind of experience affect their, for example, the perception of discrimination, or even the impact of those kind of experience on their mental health or physical health, right? So when we have this kind of research about like different groups, even within the marginalized group, they could experience racism in very different ways, then we have to think about implications. During pandemic, think about, we need to develop, for example, group-specific response, right? Because some people experience the pandemic and also racism in different ways, right? We talked about native-born could perceive higher discrimination, but foreigner-borns, when they encountered discrimination, they are less likely to use, for example, services or have lower support because they are coming from a different country, right? So we need to really think about how not just minorities in general, but more specific groups, Blacks, Jewish communities, Asians, how those different groups experience the pandemic or racism, discrimination, and then thinking about in post-COVID, for example, thinking about how to develop group-specific recovery plans and to make sure that is high equity or those, right? So this is like a very simple topic. Thank you.
Thank you, Dr. Wu. I don't think there's anything simple about the topic, and you've done a great job actually introducing more complexity with the idea of talking about foreign-born versus national-born. So it's another angle for us to think about. So at this point, I'd like to ask all of our speakers to turn on their cameras, and then we'll keep our microphones muted unless you're answering the question. So we'll have all our speakers show their camera, and then we'll mute microphones as we go through. I would like to invite members in our audience to submit any questions they have for our future speakers. If you're watching us on Zoom, please use the Q&A function at the bottom of your screen to pose your questions. We'll be welcoming some of the members of our audience to ask their submitted questions live to our panel. So keep an eye on your Q&A button for prompts and instructions from our team. And for those of you who are on Facebook, please submit your questions using the comment box to this video. So I think as moderator, I'll start with one question that, after listening to all the conversations, that really resonated with me, is Jude's symbol of the infinity symbol. And it's this idea of how it feeds past historic discrimination and policies and practices have impacted all of these communities in a way that continues and perpetuates and now compounds during the pandemic. And so picking up on Cary's last thought and of the question, and I note Irma Collins has a similar idea about what are the remedies and how do we move forward. And so I guess my question is that if you could actually select one intervention for pandemic recovery that you think could cross-cut across communities, any thoughts about what that could be? And please, anyone jump in, the speakers.
Rebecca, I might start that discussion, because I think it's really an important one. When we think about the impact that the pandemic has had on different groups of people, yes, we need to start also thinking about, well, what does that mean in terms of how we can rectify that, right? So there are a couple of things that come to mind. One is, it reminds me about the importance of collecting data, but also collecting data that's disaggregated. So for instance, when we talk about the 4 equity or the 5 equity groups in Canada, based on gender, Indigenous people, racialized people, people with disabilities, and people from the LGBTQ2S community, if we disaggregate that self-identification, we probably will be able to understand better how inequities affect different populations, say, for instance, more than others. And I think that that's one critical kind of important piece, that we need to be collecting relevant data and doing the analysis on it. That's probably spoken like a real researcher, and I recognize that. But the second one that comes to mind is when I think about people's experiences when they come up against the healthcare system. And the difficulties, for instance, that Indigenous peoples experience when they're trying to access healthcare, and they're not believed in terms of the symptoms or however they happen to present their illness, and how they're treated very differentially by the healthcare system. So one thing that we probably could do immediately is ensure that there is adequate awareness and training of healthcare professionals. And many of them probably would say that they treat, quote unquote, everybody the same, but it's not about treating everybody the same. It's about recognizing the uniqueness in the way that people present themselves, say, for instance, in emergency departments, or when they're going to access care, and how there is evidence to support that many Indigenous people, as well as Black people, people of color, how they're treated differentially in the healthcare system. And those kinds of things could be immediately addressed.
Rebecca?
Please.
This is Jack, and I would like to make one comment also. I appreciate the first comment. I think that's really good building base, because we as researchers need to understand the problem before we address it. And that type of information is very important. But the point I would like to make regarding a remedy, I think there's one remedy I would like to suggest, which is recognizing capacity. What I mean by that, one of the findings in in the research I'm working on with a team regarding the Chinese Canadian community, COVID-19 first entered into Canada January 25, 2020. And our research work in early 2020, what we found was that members of the Chinese Canadian diaspora community were taking actions like social distancing, wearing mask, and social distancing, wearing mask, hand washing, staying inside, well before any instruction was given from government authorities to take those actions. For example, think back to January and February 2019. There were trends that we found out in our interviewing. For example, a person of Asian descent sitting on the subway wearing a mask, somebody would look at that and not want to sit next to them. They'd be thinking incorrectly, is that person sick? Why are they wearing a mask? But now we know much better. Everyone's doing that. Everyone's taking actions that the Chinese Canadian community have adopted very early. And right now, if we're out in public, I would want to sit next to someone wearing a mask. They're protecting themselves and they're protecting others. But the main point being to recognize that many communities we look at in Canada all have unique capacities that can help us to address the crisis. And instead of not understanding these capacities and incorrectly looking at them as weaknesses, recognizing unique capacities, taking time to understand those things can help us all perhaps move beyond COVID-19 quicker, working together than isolating people into groups and ignoring capacities that can be brought forward by racial and ethnic communities in Canada. Thank you. End of comment.
Thank you, Jack. Any of our other panelists would like to speak? Robert, Cary, Jude? Cross-cutting across communities, remedies that may help us in pandemic recovery?
So, Rebecca, I would like to say that I think the most important remedy that I feel would be if we start digging into the stereotypes, because some of the stereotypes are there because policy makers push us to have our mind, our subconscious memory, to believe that that is true. There's a Chinese virus. The Chinese are responsible. Black people don't respect rules. If we start looking at, when somebody tells you Black people don't respect rules in your household, and you go back to find out, maybe what is responsible to Black people behaving this way, and look at the history. How can I get myself into the conversation as to how we can solve this? Then we get to a point where we have an equitable society where we will not have the pandemic stay around forever. Just a point I want to point out here is that when COVID started, racialized data have not been collected. As of this point, only 3 provinces in Canada, Manitoba, Quebec, and Ontario, are collecting data. Based on the data, Black people make only 5% of Toronto population. Toronto is collecting as a whole, as a city. But 23% of the cases in Toronto that we have is attributed to Black people. We, as a data scientist, I know that I'm more about recognizing patterns. You start recognizing patterns. What is it? You ask questions. But surprisingly, since February that the Public Health Agency made us, they wanted a One Health approach, which means that they move towards a je m'en fous, I don't care, this attitude of Black people. If Black people are dying, well, I don't care about Black people if they're dying. But if some communities are dying, we need to look at history. I have been working on modeling through the Field Institute Task Force, where we use data from previous pandemic to study what is happening in the future. Why don't we use the data to find out why is it that some communities are more susceptible? That's a very big question, and I feel that we should live here having that conversation. Politicians do not care unless we start talking about it. They don't want us to talk about it because they want to hide that, but we need to start talking about these things. Why is it that the Black community is more affected? Data science modeling is all about recognizing patterns. If there's a pattern, you dig into that to find out what is causing those patterns. We are not doing that. So I think that's a question we need to start asking ourselves.
Thank you. I think I'll move on to the next question. This question is posed by Michelle Alec. The Asian community is diverse. Can someone speak about the differences in how COVID is impacting different Asian communities, so the communities within the Asian community? Perhaps Cary, you could start.
Yeah, I could start with this question. Very good question. The main topic I was sharing about today is that yes, we need to really look at within the not just like Asian communities, within all ethnic minorities, the diverse experience, right? Or there's also not just like white, non-white, or minority, majority, but we also really need to look into specific group within, right? So for my research, for example, I look at Asians as separate, pay particular attention between the foreigner-born and the native-born, right? So we see they perceive different level of discrimination, they are impacted at different level by their experience, right? So only we have this kind of knowledge, then how to develop measures in responding to the pandemic, and also in post-pandemic, how to develop kind of like recovery plans has to be also group specific. Then those kind of measures can be more effective in planning out the policies and all that. So the message is that yes, we are in this together, but we are also not in this together, right? So in this together means we need collective efforts and then bridge across minority groups, but we are not in this together in terms of recovery plans. It's like Sheila and Jude all talked about this, that they are very, very detailed, specific differences or unequal impact of the pandemic. So that we need to pay attention to those differences.
Thank you. Anybody else would like to comment on this question? Okay, we're now going to actually call on a live question. Nazira Jaffer will ask you to unmute your microphone and ask your question now. Nazira Jaffer?
Hello, can you hear
There
me?
we go. We can. Thank you.
Thank you very much for giving me this opportunity to ask the question. First of all, I want to thank all the speakers for the wonderful presentations that you've made. Really appreciate that. And very proud to be a Schulich alumni. I have a question here. I am originally, I was born in Kenya, in Africa, in Nairobi. And I have lived, for the last over 20 years in Canada and running healthcare services. Currently, we opened the first new hospice in Scarborough. So I'm currently running the hospice there. However, I wanted to ask a pertinent question and then also share something that I do at the hospice related to all of this that we're talking about. So in my mind, when I hear all the presentations, it's very evident to me that, racism is a systemic issue. It's very deep rooted. It's been there for a very long time. It has been seen as being the norm or accepted in various traditions or pockets, and so it's a systemic issue and very intertwined with social determinants of health. Therefore, I just wonder, I think we have to do many things. And my question to the panel was, there are several steps or a several period of time that we'll have to do this to try and come close to a resolution to this issue in the long term. What is the one baby step that we can take that's going to be most impactful at this point in time is my question. And then I want to just share something I've done at the hospice, because we are open to all multicultural clients. And I'll share with you what I have done when I was establishing the hospice, just to make it very clear from day one what we're standing for. So I'm going to let the panelists give some of their comments. Thank you.
Thank you, Nazira. Would someone like to talk about a baby step, something that could be done? I think when I think baby steps, maybe something that could be done tomorrow that we could advocate for to help pandemic recovery.
This is Jack. I have one comment to the question. First, I'd like to thank the person who asked the question for their important work on the front lines of the community and the hospices, where we know, especially in the city of Toronto, given the situations that we're facing, that's very important, much needed work right now. But briefly, my comment on a baby step. There's two ways that we can fight COVID-19 right now in general. The first way is by pharmaceutical measures, meaning shots in arms. We're making progress, but we're not there yet. The vaccine distribution to society is taking place, but for a variety of complicated reasons, it's not taking place fast enough as any of us would like. So we're left with the second general means to fight the vaccine, which is non-pharmaceutical measures, meaning social and behavioral actions that we can take, both on an individual and a community level basis, to continue to fight against COVID-19 until enough of us get vaccinated to make a difference in the spread of the disease on a community basis. But for the time being, the baby step would be, I would recommend, and I think we already know this, stay at home, wash your hands, wear a mask, social distance. We're a year into this. We're fatigued. This sounds like a broken record. We're repeating it, but a lot of these complicated things are not going to matter, the more complicated steps, if all of us as individuals become fatigued and don't maintain our vigilance and our basic steps of individual pandemic safety, which we can implement on an individual basis. Wearing a mask, washing your hands, staying at home, stopping the spread. End of comment.
Thank you. Would anybody else like to comment? Jude, please.
Rebecca, I have been part of the modeling task force before HAC, and what data have helped us with recognizing patterns in order to make certain scenario studies and inform public health agency have actually helped us to cope with disease. The outcome will have been worse than what we have seen, if not of the results that myself and my colleagues at the task force agency at the Field Institute have been doing. So how do I recommend this moving forward? The problem in Canada, which I feel that we need to borrow from other countries like UK and US, is collecting data on racialized group. And I want to ask this is in addition to Jack, we need to stay away from everything, social distancing, respecting all public health agency or non-pharmaceutical intervention policies, and take the shots when they're available. But it's more important if we can collect data on these minority group to find out. You don't collect the data without engaging the communities, no, because the history that shows that there's misuse of data. You engage the communities, you get the community leaders among your group, you collect data with their own inputs and use that data to inform policies. Believe it or not, any lockdown policy that we have in Canada or the number of cases we have been able to avoid is as a result of the modeling that the Canadian Task Force modeling has been doing. This is just something we've been doing to inform these policies. But no racial issues. Nobody cares to look at why is it that this particular race, why is it that out of Canada, Toronto, for instance, have 50% racialized group, the population, but 83% of the cases or 80% of the cases in Toronto are from racialized group. Why is it that the Black population of Toronto is around 9 to 10%, but 23% of the cases are Black? Because our policymakers do not care about this. They move to this point where they are like, well, they are Black people. I don't care about Black people. Black people are responsible. They should die. Nobody cares about them. If you move to this, when you are able to take racialized data and inform policies, that will help. So I feel that data is very important. That's the point I'm trying to make here.
Thank you. Anybody else on baby steps? Cary.
That's a very similar question like Rebecca asked. Right? So that what is the baby step tomorrow what we can do. So one thing, simple point is that we being like as ordinary citizens, we being in pandemic for so long, everyone exhausted, right? So the only thing like can unite us and then do things is political performance. For now, I was thinking that political leaders really need to show their efforts and performance and communicate with us, public, very well, and demonstrate that we give us hope and give us like a final step to finish this, like to recover well from the pandemic equally. So that's one simple message I think we should do.
Sheila.
I'll just go back to my first point about data again. I think one of the basic things that people can do just generally is to educate themselves, not about the pandemic, how it is spread, how to prevent, but also how it impacts different groups of people differently. And I think if you take that small step to educate yourself, it can actually go a long way in terms of understanding. I guess I'm always kind of the believer, if you understand something better, you're probably more likely to make some changes.
Thank you. Anybody else on this topic? Thank you, Ms. Jeffers. I think we'll actually move on to the next question just to allow other people to be able to pose their questions. So David Alward asked the question and wanted me to relay that these were tremendous presentations and to thank all the speakers. Can anyone provide comments as to whether these issues and pandemic discrimination is occurring elsewhere in the world? Talk about other countries and how they're managing racism in the pandemic.
Rebecca, can I start from there?
Please.
So the UK realized that 2 out of 3 cases in the UK was related to Black population. And why was this important? How did they get to this? I want to go back to Sheila's point of data being very important and engaging the communities. I don't want to say just we should collect data without engaging the communities. We need community leaders when we're collecting this data so as not to misinterpret the data, to have the community leaders have the same. Through that, when you do that, then you lead to a modeling point where people are asking questions about certain things that will affect the communities. In Canada, our policy makers have been very smart, doing a great job of bringing us together. But what they have failed in is trying to get this racialized data. And only 3 provinces in the entire country are collecting data. So I believe, as Sheila rightly said, in collecting racialized data and pushing, not just collecting racialized data to please people like you and I, or people in this forum that will be advocating for this after this, because I know all of us will be fighting to ensure that our politicians are collecting racialized data to inform policies to ensure that we get rid of this monster COVID-19 that's spreading around our communities. But not just doing it in that point, but really ensure that when we collect this data, we bring in these community leaders that will push into modeling that will inform policies about these communities. That is the only way we'll get rid of this. So collecting racialized data, bringing in community leaders, and ensuring that you push for models, which means that they need to be people from this racialized group in the modeling task force or in the decision making that will push for models that will address these issues.
Thank you. Anybody else would like to discuss the other countries and how they're managing racism during the pandemic and any of the inequalities that are arising?
This is Jack. I have one comment that I'd like to provide. My comment is, right now we have globally about 2,500,000 persons have died from coronavirus worldwide. In places like the United States, we've recently passed the death toll of 500,000. So when we look at our topic we're focusing on here, discrimination and racism to the pandemic, we're finding this to be a global phenomenon where it's not in one country specifically, but many countries are facing similar experiences with what we're finding in the narrow focus of our research: discrimination, stigma, fear, and misinformation, going back to the global Asian diaspora on various portions of the virus. A portion of the research I'm engaging on with the team is taking place in Kenya and Nairobi, where we're asking similar questions about stigma and discrimination. And while we're finding that localized circumstances are unique in terms of population backgrounds and health outcomes, that this age-old story of fear, stigma, and discrimination is not something I think we would classify as a specific national phenomenon, but it's a global phenomenon taking on its own iterations in many different national contexts. End of comment.
Thank you, Jack. Cary, please.
Yes, just follow up on Jack's point that is like, for example, for the anti-Asian racism is really a global phenomenon, like everywhere in Europe, in the United States, and many other countries. But I want to add one point is that, like, when we think about offline, online, now like racism is everywhere online. So even people experience or instance of racism attack in Canada could impact everyone, everywhere, right? So for example, when I saw the news in the US or in Europe that I saw people being attacked, it really give me headache, it really affect me here locally, right? So this is like digital racism or racism online. There's no global or like boundary, like a country limit. It's really affect people everywhere globally.
Thank you, Cary. I think you're reminding us all of the global village and how when we hear, we almost, it affects you wherever it's happening now that we have access to it at all times. I think especially going through the last few months and watching what's been happening in the United States, I definitely can resonate with that comment. Any other comments about other countries and how they're managing and how they impacted the pandemic and the intersection with racism? Okay, I'll go to the next question. This question has been posed by Tyler Senak. Are there specific strategies that will help combat disinformation, particularly in racialized communities, to help us get through the pandemic? Perhaps a strategy dedicated to getting doctors from those communities to come together in a public education campaign. So I think the question is really centering on particular strategies within communities that could help combat disinformation for racialized communities.
Rebecca, can I step in there?
Please.
Yeah, within my community, I'm a Black and I'm very much engaged in my communities all over Canada. Because of the distrust that people have with our institutions, when we start talking of the vaccines, a lot of people do not trust the vaccine. I've been in a lot of social media groups within my communities. A lot of people don't believe. I have tried, I've been doing a great job on my own. But I believe that if we want to get to a point where my people or other people within other racialized groups trust this, engaging the community leaders, getting them involved so that they know, because community leaders, I will never mislead my people. I will never, ever stand. And I believe that is the same with my community leaders. Bringing community leaders into these decisions, when we're making these decisions, is very important. Having their voices is very important because they will be able to inform the communities. I will listen to my community leader if they tell me, trust this. Yes, I trust it because I'm a modeler. I believe in data. I have been studying this, but a lot of people in my community, because of history, do not trust in the vaccine or what policymakers tell them, because they believe that policymakers have been making politics to get rid of their group, to get rid of anybody that look like me. They don't want them. And so a lot of people, when you tell them this is what is going to happen, those rumors, they will believe in those rumors more than what our policymakers are saying, because there's nobody that look like them that is making those decisions. So by bringing them there and having them engage in reaching out to their communities, that will solve some of those problems. So I believe that engaging the community leaders, not just my own community, you bring a Black person, other communities, you bring their leaders, that's very important.
Thank you. Any other responses to this idea of disinformation and what would be needed in particularly racialized communities to help get through the pandemic? Or information disinformation campaigns to battle disinformation, I should say. Okay. The final question, and this one actually is back to you, Dr. Kong. And I'll just read the question. Dr. Kong, as you know, there is an aversion to collecting proper diversity data in Canada. Yes, finally our government is starting. Can you suggest how DEI practitioners can encourage and then hold corporate Canada accountable for such data so we can identify and therefore address obvious systemic racism? Is there a bigger collection of data happening for corporate Canada that you know of? The US is way ahead of us on data collection. Can you suggest where we find anything specific Canadian data or studies available to refer to corporate racism if possible?
Thank you so much, Rebecca. Canada has been lagging behind UK, United Kingdom, behind US. UK, based on their data, have done a study where they realized that 2 out of 3 persons that get infected with COVID are Black. US have done it. They didn't give that statistics specifically, but they listed that a greater proportion. In Canada, we moved to this silent racism where we believe that, well, we want to take a one health approach, only when it's affecting the Black community or other racialized group. We want to take a one health group. We don't want to look at this. As a data scientist, when you realize that a group of people, there's something prevalent in a group of people, you want to dig into that. But our policymakers did not. And you may think that that is, well, they're doing the right thing, or, well, they're moving I would know. No, they're doing it for a reason. This group of people need to be suppressed. They are to be blamed for everything. Only when we start as people here having this conversation within our dining tables and pushing politicians that they will listen to us. So the question was, within our group, Canada's lacking behind. How do we get to that point? I think that if we can push our politicians to a point where they collect racialized data, not just collecting on their own, but engaging community leaders in collecting this data, I feel that, and when the Public Health Agency of Canada, FAC, met on their weekly call, they informed professors like myself and other my colleagues to work on research relating to race issues. I feel that we'll address these issues. But if they are not interested in this, if we don't push them, believe me or not, it will lead nowhere. And COVID will stay forever if we are not able to address these issues within different communities. FAC will only act, politicians will only act if we push them. They don't care at this point. But we need to have this conversation on our dining tables. If we want to get rid of COVID, we need to get rid of COVID from every community and stop allegations and blame our politicians to ensure that they get data. Before COVID came, we had data from past pandemic. Nobody care about why is it that racialized groups have been affected in past pandemics. They only care about COVID. You know why? Black lives do not matter. Indigenous lives do not matter. We need to push them to have those lives really matter, as we think that they really do matter. Thank you.
Thank you. I actually want to thank all of our panelists now. As we close up, the time has run out. We didn't get through all the questions, and I'm sorry to all of those people who posed questions. I want to thank our panelists for being here with us to lead this important discussion. It was an honor for me to host all of you this morning. You've all emphasized the point that due to historical inequity, if we try to treat all Canadians equally to get through the pandemic, equally we won't achieve equality. I want to turn it over to Julie Lafford for a few final housekeeping items before we say goodbye. Thank you again.
Thank you, Dr. Pillay-Riddell, for leading us through that thought-provoking discussion. And again, as I said before, deeply relevant right now. Thank you all for bringing your remarks to this group. And Rebecca, especially for your commitment to public education. It's such a pleasure to work with you. Drs. Rozdilsky, Cote-Meek, Kong, Kenedy, and Wu, thank you again for your time today, for your commitment to public education. I know several of you have done a couple of alumni talks now, and I really appreciate it personally and professionally. And we're always pleased to be able to give a platform to these important conversations. I wish we had more time for questions because this is such an interesting and important topic. So thank you again. And thanks to the audience for taking the time to join us and participate in this Q&A session. Before we draw the names for prizes, I do have one last poll for you. And this helps us understand the effectiveness of the events that we hold. And our question now is, how would you rate your knowledge of the topic of today's presentation following this discussion? So that should appear on your screen now. And I'll give you a moment to reply. Thank you for responding. We review these poll answers and we take into account as we plan for the future as well. So now it's time to announce the winners of today's $25 gift cards, courtesy of our affinity partner, MBNA. And those are available to those who registered for and attended today's sessions. So congratulations to Hillary Turney, Linda Pollock, Peter Duer, and Seema Basai. Our team will be in contact with you after this event to fulfill your prize. Our next session, York Circle event, as Rebecca mentioned at the beginning, is scheduled for Saturday, April 17th, and it's titled The Impact of the Pandemic on the Environment, which I'm sure will be just as thought-provoking as this discussion, and I hope to see you all there. You can register for that event and find more information about upcoming York Circle at Home events on our website, yorku.ca/alumni and friends. Just click on events and then York Circle. The link should appear in the chat section now. And finally, as ever, we are always interested in hearing from you. So any suggestions or feedback that you have for us is always welcome. Please send it to our email, alumni@yorku.ca, or through our social media channels. You can join our LinkedIn group or follow us on Facebook by searching York University Alumni, and follow us on Instagram and Twitter @YorkU Alumni. And as I said before, today's presentation will be posted on our York Alumni YouTube channel, and we encourage you to share with your friends or anyone who may be interested in these topics. Thanks again, everyone, for being here, for spending your Sunday morning with us. Take care of yourselves and each other.